Okay, so good morning, everyone, and thank you for making today's meeting. Uh, would everybody who is a committee member please make sure you have CA so that we can track you more easily. Uh, yeah, uh, okay, so why don't we do um, for committee members, your name, who you're associated with, your personal pronoun, just to do quick introductions. Uh, I can just go through the list if that works. That way we can take care of our attendance. Um, Aaron Hines. Okay, we just heard that Elena is going to be late to this meeting. Alicia Jackson. Hoi Vu. Eric Weiser.
Yes, I'm here. Eric Weiser, I'm community member. My pronouns are he, him. I work at OHSU as the Assistant Dean for Rural UME and also the Director of the Oregon AHIC. Thank you.
Welcome. Gabriela Carrillo. Gretchen Horton Dunbar.
Good morning, Gretchen Horton Dunbar. I'm a consultant with Mercer, and my pronouns are she, her.
Okay, welcome. Uh, Jason Johnson.
Hi, everyone. Jason Johnson. I use he, him pronouns. I'm a dean of Portland Community College, where I support a portfolio of healthcare education programs.
Welcome. All right, Judy Geiger. Kelly McKnight.
Good morning. My name is Kelly McKnight. I use she, her pronouns, and I'm the CEO of Options Counseling and Family Services.
Welcome. Laura Chan. Levi Anderson.
Hi there, I'm Levi, he, him. I'm with Self-Sufficiency Program with ODHS in Grant, Harney, and Malheur counties supporting employment training programs.
Welcome. Manu Chaudhry. Megan Holland.
Megan Holland, she, her. I am a CMO at Coquille Valley Hospital and Regional Associate Dean for Campus for Rural Health on the South Coast.
Welcome. All right, Molly Reynolds.
Good morning, everyone. I'm Molly Reynolds, she, her pronouns, and I'm the program manager of the Care Pathways program for RISE.
All right, welcome. Rob Ross.
Hi, Rob Ross, formerly with St. Charles, now retired, thank goodness. Um, he, him. I was the director of academics and research there.
All right, congratulations. And welcome. Bob Lieberman.
Hi, Bob Lieberman. I'm from Grants Pass, he, him. I ran a mental health program for youth and young adults for about 40 years, and now I'm a consultant and trainer in my own business.
All right, welcome. We heard Dr. Hemmings won't be with us today. Stephanie Grayson.
Hi, I'm Stephanie Grayson. I'm the Chief Human Resources Officer at Adapt Integrated Healthcare, and my pronouns are she, her.
Okay. Surya Karlapati.
Hi. Morning. Surya Karlapati, he, him pronouns. I'm an attending psychiatrist at the Oregon State Hospital here in Salem.
Welcome. And Tessa Christensen.
Hi, I'm Tessa Christensen. I am the contracts manager at Best Care Treatment Services. I use she, her pronouns. And yeah, I'm here.
Welcome, welcome. And I'm Ian Strauss. I use he, him pronouns. I am the chair of the Healthcare Workforce Committee and a retired healthcare administrator for a federally qualified health center, as well as a consultant on healthcare practice. So,
And
let's
Ian, while we were doing roll call, I noticed that Laura and Judy joined if they want to introduce themselves.
okay.
I'm Judy Geiger. I'm a retired nurse executive and I live in Seaside, Oregon. And I use she, her pronouns.
Welcome.
Hi everyone, I'm Laura Chan, fourth year medical student at OHSU, and I use she, her pronouns.
Welcome. Okay, let's go to the next slide. Just did that one. Next. Okay, a little bit of housekeeping. So this meeting is open to the public and welcomes public testimony. Are we doing public testimony today? Yes, and welcomes public testimony. The meeting will be recorded. Live transcripts will be available. And if you're on the committee, please turn on your camera if you're able. All right, next slide. Okay. We would like first to welcome all the OHA staff today who are on the call for all the great work they do for us and for the community. And if you're a guest or OHA staff, we would like you to put your name and your affiliation into the chat. Okay. Here's our list of OHA staff. Again, thank you. Next, and here's our agenda. So let's see, we've done our introductions. We're going to review the health equity definition and the health equity framework, do public comment, and then we will look at the healthcare provider incentive program budget allocation for the 25-27 biennium, and that will include a vote. So please be aware this lets the money be spent to work on our healthcare provider incentive program. So it's a pretty big deal. Let's see. Okay, so next slide. The health equity definition and framework. Next. All right. So as we do in every meeting, because this definition really informs all the work we do and how we move forward, we're going to read I will read the health equity definition. If anybody else wants to read it, please let me know. I'd be happy to let someone else do this as well. Okay. Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments, to address the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and contemporary injustices. Just let that sort of settle into the meeting as our guiding principle. Next slide. So this is the questions for the equity framework, the guiding questions. I'm not going to read all of these today, but be aware this is something, these are ways to look at operationalizing that health equity definition, things to look at. Next slide. Okay. Let's see, Deepti, do we have any public comment?
Nobody has reached out to me for public comment. How about you, Annette? Have you heard from anyone?
I have not.
Okay. Is there anyone on the call today who would like to give public comment? Okay, hearing no requests for public comment, we'll move on to the next slide. Okay, Healthcare Provider Incentive Program Budget Allocation Proposal for 2025 to 2027 biennium. Let's see, who was doing this presentation today?
Ian, it's Jill Boyd and myself. I can take over.
Okay, all yours. Thank you.
Great. Thanks everyone for joining us today. I know this is a special meeting and an extra meeting, and we really appreciate your willingness to join today for this important topic. I know we had seen these questions, but just putting them up here again as a reminder that this is, work that the committee did almost 3 years ago, did a series of listening sessions, and then adopted these guiding questions. And it's through this framework that we developed this budget proposal for your consideration. Next slide, please. So today, Jill and I are going to be reviewing, and some of this might be familiar to you because we just had the evaluation of the healthcare provider incentive programs in Oregon approved. But we're going to just, to make sure that everyone has the same information, we're going to provide a brief overview of the Healthcare Provider Incentive Fund. Then we're going to also speak about the budget allocation approval process and timeline, talk about the program that exists within the fund, and then talk about the budget allocation proposal for the current biennium we're in, and then go through incentive by incentive, the rationale for that budget proposal. We will spend some time going through with you the administrative costs. We want to make sure that you understand that. You'll see that there's an increase proposed this year, and then take any questions and comments. And then we also hope that you will approve the budget today. And lastly, we also included just a reminder of the overall data from the recent evaluation is the last slide as a reference. Next slide, please. All right, so going to start by giving an overview of the Healthcare Provider Incentive Fund. This slide probably looks familiar to you. The purpose really is to help practices, professionals, and people. We've heard from many partners, many of you, that these incentives offer important and critical recruitment and retention tools, so that practices can have the workforce they need to deliver patient care. These set of incentives also provide important education debt relief to students and practicing professionals. And then lastly, it increases workforce diversity in local communities. Next slide. Again, this will be familiar for those of you who recall from the evaluation, but just again, want to make sure you all have the same information. The legislature passed House Bill 3261 in 2017 that created the Healthcare Provider Incentive Fund. And this fund consolidated multiple incentives into a single pool, and created the Healthcare Provider Incentive Program. And this here is a list of the initial incentives: loan repayment, primary care loan forgiveness, the Scholars for Healthy Oregon or SHOE program at OHSU, the SHOE-like scholarships, and the Rural Medical Practitioners Insurance Subsidy. That legislation also directs the Oregon Health Policy Board through OHA and its partners to conduct a healthcare workforce needs assessment and evaluate the effectiveness of state financial incentive programs. And then lastly, and why we're here today is it directs OHPB to determine the best allocation of monies in the Healthcare Provider Incentive Fund. And so that's, as we're at a new biennium, that's why we're here. Next slide, please. So this will give you a little bit more information about the approval process and timeline. Next slide. So OHPB does rely on the recommendation from the Healthcare Workforce Committee and the Healthcare Provider Incentive Team in approving allocations each biennium. We also, from time to time, have come to you and requested adjustments if needed. The program is administered by the Healthcare Provider Incentive Program in collaboration with the Oregon Office of Rural Health. They are very important partners to this work. And the fund and the program are under the policy direction of the Oregon Health Policy Board. And again, as a reminder, the fund allocation is required by House Bill 3261 to be influenced by both the needs assessment and the evaluation report. Next slide, please. And then, today, again, we're here to review and approve the budget, and then we are planning to go to the September 9th meeting for OHPB review and approval. And then after we receive that approval, then the program can begin spending the funds in accordance with the approved budget. And so we're going to now get into the budget allocation proposal. Next slide, please. So I will turn it over to Jill to start with this part of the presentation as our subject matter expert. You'll see that, this biennium, we are proposing many of the same incentives with an overall budget of $30 million, 0.34. Yeah, I'll turn it over to Jill.
Thanks, Neelam. Hi, everyone. I'm Jill Boyd. I use she, her pronouns, and I'm the Healthcare Provider Incentives Coordinator. I'm the lead for this work that we're doing, and I appreciate your time today. I'm also based out of Eastern Oregon, so a lot of this work is near and dear to my heart as I've been living and working in a rural community for quite some time. So we're going to talk a little bit about our biennium budget proposal. So this is this is our overview. We'll share this again at the end of the PowerPoint slide as a review. There's a couple things of note that I wanted to share with you all as we kind of get into the justification for these adjustments. The first being the line item for the healthcare loan repayment program. You're seeing a bit of an increase. There's some reasons for that, mostly based on incentive demand. We've seen a significant, almost 40% increase in the applicants coming through for both our provider incentive loan repayment program as well as the behavioral health loan repayment program just in this past biennium. So we believe that we want to be able to adjust our budget in accordance with the demand that we're seeing. We're also including we have the state loan repayment program, which I believe Bill Funder and Robert Dumeg from the Oregon Office of Rural Health presented at the last Healthcare Workforce Committee. We are also proposing a match fund of $900,000 for the 3-year of the grant program for this state loan repayment program. And we'll go into a little bit more detail about that here in the next couple slides. The other main change I wanted to highlight for you all today is down at the administrative costs. You'll notice there is a little bit of an increase there. Try not to get it too excited. It's a little more than what we've seen in previous years. Part of the reason for that change is You'll notice at the very bottom of that $30.34 million, we are not including our administrative costs. We're not carving this out of our $26 million that has been allocated to us from legislation. This administrative cost is $4.34 million is coming out of interest earnings that we put within the Healthcare Provider Incentive Fund as an interest-bearing account. So we're using administrative costs from the interest earnings from our interest-bearing account this biennium. Therefore, we're able to allocate that full $26 million that is coming from legislation back into all the incentives that you see listed here. And we'll go into a little bit more detail about that later in the slides as we talk about the breakdown of the administrative costs. So I'll have us go to the next slide. This is really our framework for the Healthcare Provider Incentive Program. This was a beautiful little graphic that we pulled that was included in the evaluation report that was most recently approved this spring. But really, we're trying to hit all points of intercept for healthcare career opportunities. That includes creating career entry pathways through our secondary education, our healthcare workforce pathway scholarship program, onto higher education and supporting primary care loan forgiveness, as well as our new healthcare workforce scholarship, or formerly known as SHOE-like. And then also assisting in the advancement and retention of healthcare providers and workforce within the state of Oregon, and doing so through the healthcare career pathways and retention incentives, which we'll talk a little bit more about, rural insurance subsidy program that we've had for a very long time, as well as loan repayment. Next slide, please. So first, we're going to talk about loan repayment. So again, this is an $11.35 million proposed allocation. I won't go into too much detail since a lot of this information was included in the evaluation report, so I don't want to be redundant and we're kind of limited on time. But as a reminder, these are awards for practicing healthcare professionals that provides tax-free funds to repay up to 70% for qualifying student loan debt in exchange for a service commitment. In the 23-25 biennium, we did reintroduce behavioral health professionals, as well as adding dental assistants and dental therapists, although we have not had anybody apply from the dental therapist field, but we have been able to see a lot of applicants for dental assistants, as well as awarded dental assistants as part of the loan repayment program in the 23-25 biennium. And as I mentioned before, the demand for this incentive continues to grow and exceed the available award amounts. And you can see that over on the table or on the graph to the right. We've had in this last biennium, 23-25 biennium, we've had 96 students awarded with over 430 applicants in that biennium. Are we taking questions now, or should we wait till the end? I think, Manu, we might wait till the end, if that's all right with you. I see your hand up, but I didn't want to, I'm not sure what the protocol is for that. But we'll come back to your question on loan repayment here in a moment. Let's move to the next slide. So this is just to provide a little bit of rationale and adjustment considerations for the incentive. As I mentioned before, we're requesting an increase to $11.35 million from the $8.1 million that was allocated in the 23-25 biennium. The reasoning for that includes we are wanting to support the Oregon Office of Rural Health federal state partnership loan repayment grant application, which is funded through HRSA, or the Health Resource and Service Administration. And this will help spread the loan repayment awards because we're getting some federal match dollars to support the primary care disciplines. We're also interested in considering piloting other high demand disciplines based on data through needs assessment, through other national and state trends, community engagement, and of course, the healthcare need within the state of Oregon. We do have some rationale for adjustment to this increase. Again, we wanted to showcase our 2025 evaluation report and other national studies that are indicating that we are seeing that providers who participate in a service-dependent loan repayment program are more likely to work in those areas of high need, such as rural and medically underserved areas, and they're more effective in retaining providers, especially if they have a significant amount of debt. The loan repayment program allows providers to participate in the program for up to 9 years of a service commitment, and they can pay up to 100%, depending on how many, if they participate for the full 9 years. So if they've got a lot of debt, we really like to see them come back and continue to apply and remain and develop that kind of community of practice that they're practicing in. And as well as what we've seen within our loan repayment program, 92% of the loan repayment recipients have continued to practice in Oregon even after their service commitment ends. We've been tracking that for up to 5 years. As well as qualitative survey results indicating that this incentive has lightened financial and mental burden to support professionals' continuation to live and work in an underserved community. So down here at the table, you'll be able to see actual numbers of the allocation versus how many providers were awarded within that biennium time. And then this is with the increased of proposed budget. This is what we're estimating we could see providers awarded. And yes, the number of providers awarded has gone down while the allocation amount has gone up. There's a lot of reasons for that. Primarily, it's due to student debt load. We take into consideration undergraduate as well as graduate debt load if it's eligible. And we're seeing an increase in student loan debt. So, and we're also, because of the variety of disciplines that we're awarding, a lot of them have a large amount of debt. And so we're not able to award as many people, but we're awarding them at the maximum amount that they're eligible to be awarded for that grant cycle. So we do recognize that, but there's a lot of factors outside of our control that we're not able to remedy. Next slide, please. Moving on to the primary care loan forgiveness incentive, we're proposing a $1.1 million allocation. And again, just to review, this is a student award for full-time students in an approved rural training track educational program. They're able to receive funding during their education in exchange for a future service obligation. And in the 23-25 biennium, we've added a new nurse practitioner education program called Frontier University, who we just had our first round of awards the beginning of 2025. This award again, or this incentive really focuses on rural communities and helps to ensure that rural clinics have access to quality clinicians. And in maintaining with our health equity efforts, we are seeing approximately 27% of recipients from this award are identifying as students of color or from tribal communities. And as you can see on the right side, I won't go too in depth into it, but in 2025, we were able to award 75% of those who applied for this incentive. So if we can go to the next slide. We are hoping to do that and maybe even higher in the 25-27 biennium. So we are hoping for a little bit of an increase, about $100,000, so that we can continue to consider the critical access needs of rural communities in the eligibility of healthcare disciplines and education programs. The rationale for this adjustment is very similar to what we did for loan repayment, so I won't repeat that. I will state too, that was included in our evaluation report, that 89% of our graduated primary care loan forgiveness students who are practicing professionals have remained either at their same practice or an equivalent qualified practice site, a rural practice site at this point in time. And so you'll see down at the bottom here, we have, again, the number of students that were awarded based on the amount of money allocated. And then our proposed allocation is to just slightly bump that up a little bit. And hopefully we can award a few more students in this biennium. Next slide, please. Take a little sip here. Okay, the Scholars for Healthy Oregon Initiative, or SHOE, we're proposing $5 million. This has not changed for several bienniums. OHA contracts with OHSU to administer this incentive, and the $5 million is established in statute in this ORS 348.303. So we did want to provide some information to you. What this does, this provides full tuition and fees to students at OHSU in the clinical programs listed in the table to the right. And again, this is in exchange for a service commitment at a qualifying practice. Next slide, please. So because this is, we're not proposing any additional funding for this, because that $5 million is pretty set in statute. I did want to just point out some items of note that we are going to continue to work with OHSU to work towards improving the reports on the equitable distribution of the awards, as it is part of our health equity initiative to monitor these funds and ensure consistency with our health equity framework and the Real D reporting requirements. So we are seeing as well that the institutional climate and educational support at this level does have an impact on diversity and equity, especially post-residency and into employment. So we want to continue to support this work, but we didn't include any estimates because that $5 million is pretty standard, and this is basically a pass-through fund back over to OHSU. Next slide, please. This is where we get real excited and our smiles get real big. We're talking a little bit about the scholarships, career pathways, and retention incentives. We're proposing a $5.75 million proposed allocation for this. We've had some scholarship programs in the works during the 23-25 biennium, and so I wanted to highlight those again for you because some of them were not included in the evaluation report, as the evaluation report data cut off in June 30th of 2024. So I wanted to share a little bit more information since we have some additional numbers. But these scholarships are to fund tuition and fees to support current and new incentives, with the intention to help expand and diversify the healthcare professional workforce, particularly those who serve people experiencing health inequities due to lack of culturally specific and culturally responsive care. So you're probably very familiar with, the Healthcare Workforce Scholarship, or formerly known as SHOE-like. We've also added the Healthcare Workforce Pathways Scholarships, which is intended to support secondary school participants interested in pursuing a healthcare career. And then we also have a couple retention incentives to support the healthcare interpreters as well as behavioral health workforce. And we'll get into that in the next couple slides. Oh, go ahead. Next slide, please, Annette. Thank you. So this is the Healthcare Workforce Scholarship, or formerly known as SHOE-like. This is a little bit of background. Again, I won't go into detail, but just to highlight a few things. In the 2019-2021 biennium, we only had 3 graduate level disciplines, and we were able to serve 14 students with that $1.35 million. Once we started expanding our reach and including community colleges and other state universities across the state of Oregon in the 21-23 and subsequently 23-25 biennium, we're starting to see a lot of growth in the number of awards that these educational institutions are able to make, as well as including other fields such as dental assistants, registered nurses, EMTs, speech language pathology. And then we've, if you'll see over on the far right corner, we just finished the execution of contracts for the 23-25 biennium. So we have some estimated numbers with our current universities and community colleges that are participating in this scholarship with an average of, or not an average, but an actual number of $2.15 million. And so far we've seen 9 graduated students are in their service commitment. Again, 37% of the awardees identify as a person of color or tribal member. And in this 23-25 biennium, we did expand. So we're covering all disciplines: physical health, oral health, and behavioral health disciplines as well. Next slide, please. Moving on to the Pathways Scholarships, this is to support secondary school participants, so high school, middle school age kids interested in pursuing a healthcare career. And we were really excited to award 6 amazing pathway programs. They're either year-round programs or summer programs. We know that a lot of the AHEC summer programs, MedQuest has already taken place, so we're getting some really good information back from that. And data collection is currently underway, and a lot of our awards will be distributed in this fall of 2025 as the school year starts back up again. So we're kind of estimating, really hitting anywhere from, 500 to 1,000 students with some of these awards. And we've allocated 1.53 million in the 23-25 biennium to support this work. Next slide, please. And then as far as retention incentives go, in the 23-25 biennium, we were able to support 2 different paths for retention. The first one is to support the behavioral health workforce. We're working in partnership with MACBO, or the Mental Health and Addiction Certification Board of Oregon, to help with registration and advanced exam costs. So you can see this is just their first report for year 1. And you'll be able to see that these are for increasing their certification. So if we have a provider that's a certified recovery mentor 1, they're calculated into that 96 number of awardees that has taken the exam to become a certified recovery mentor 2. So we want to see that retention of this workforce, and we want to support the increase in their certification level. Either it be a CRM, Qualified Mental Health Associate, CADC, or Certified Alcohol and Drug Counselor, or jurisprudence. And so we've allocated $1.35 million in the 23-25 biennium. We've already had 313 individuals receive this award and pass their exams, not just take them, but they've passed them. So they're in that next level. And then we anticipate anywhere from the same amount, around 285 to 375 in year 2. On the right column, we are also supporting the healthcare interpreter training programs that are designated by the state of Oregon. We have just launched into these contracts. We have 9 training programs that have completed a non-competitive grant process. And we anticipate anywhere from 200 to 270 individuals to award for these programs with only $250,000. Seems very small in comparison to some of our other awards, but this has been a really great partnership with a lot of our interpreter programs, and we also are hopeful to support community health workers that are also wanting to engage and become an interpreter, a certified interpreter as well. So this covers the cost for that. Really exciting stuff. I could go on all day, but I digress. We need to move on. So next slide, please. So with this $5.75 million proposed allocation, as we mentioned, we want to expand the number and breadth of the healthcare workforce scholarship training programs with a broader outreach plan and continued focus on supporting diverse students. We were really excited in this last biennium to see Eastern Oregon University, Southern Oregon University, Rogue Community College. We're getting a lot more community colleges and other educational institutions across the state of Oregon. So they're not just in that I-5 corridor. So we're really excited. And we want to continue to provide some broader outreach so that we can continue to do this in the 25-27 biennium. In addition, we also want to continue and expand the career pathways and retention incentives in this next biennium as well. So just a little bit of rationale for adjustment. We are seeing a proposed allocation from $5.35 million to $5.75 million.
Always that color?
Sorry. There we go. Thank you. And just to provide a little bit of rationale, we are seeing some evidence that pathways incentives for students really do help them gain confidence and knowledge in their field, with over 65% moving into their field of study and hopefully onto graduate school. as well as supporting retention efforts, which can lead to an increase in productivity and reduction in turnover rates, which we know, especially for small, rural, medically underserved practices, can be very financially straining. Next slide, please. All right, one more incentive before we get to the admin costs. This is the Rural Medical Practitioners Insurance Subsidy. We're not proposing a change. We have $2.8 million that we're proposing to allocate to this incentive as well. Just as a reminder, this was launched under House Bill 3630 in 2003, and the intention is to provide partial malpractice premium subsidy payments, really focusing on those who are practicing in obstetrics, pediatric, and neurology specialties. You know, we have seen a kind of a little bit of a steady decline, mostly because a lot of providers are part of a larger health system and they're receiving group coverage through their health systems or other larger systems of practice. We have, however, seen 3,665 unduplicated providers between 2018 and 2024, based on our last evaluation report, have been able to receive the incentive. And we know with a lot of the work that we've been doing with grants past and the urban rule change, and then now it's changed back, we do see a value in this. And we're seeing a lot more information from our providers that highlights that as well. Next slide, please. So as I mentioned before, even with the gradual decrease in the overall participation, there is a long-term provider investment. We want to continue to support the recruitment and retention of practicing professionals in rural Oregon. We don't have a ton of data to compare. Unfortunately, we're one of the few states that offer this incentive. So there's not a whole lot of national data, but we have been getting a lot of great feedback from our providers who've been on the receiving end of this incentive. And we're still seeing that there is it is an important incentive to help support retention efforts, especially to those practices in rural areas. So we're not seeing an increase. We're not proposing an adjustment to that $2.8 million. We haven't hit that target in the 23-25 biennium, so we still have a little bit of money to roll over into the 25-27 biennium. So we're not requesting any additional funding aside from what we've allocated in the past. And again, we hope to maintain a steady estimated level of participation from our providers at around 400 to 450 over the course of the next 2 years. Next slide. All right, here we go. Let's buckle up, kids. We're getting into the administrative costs. Next slide, please. All right, so we are proposing $4.34 million for administrative costs. We realize that this is a little bit more than what we have previously allocated in the 23-25 biennium and several bienniums before. But we do have some differences that I wanted to share with you all today. We are great partners, I'd like to think, I hope they think the same, with the Oregon Office of Rural Health. And we have an intergovernmental agreement with them to support a lot of the incentives that we offer. It's a lot of work to be able to do what they do. They have to vet all the applications, which, as I mentioned, has increased about 40% in this last biennium. They also have to make sure that all of the debt is eligible debt load. There's a lot of detail. There's a lot of paperwork that goes into it, and there's a lot of data that has to be captured. So because of this, we're proposing a bit of an increase with their IGA to support this enhanced workload. Also, in addition to the data tracking, management, and oversight of the service commitment for all of our providers, we also rely on them to do a lot of our marketing and outreach, since they have, they've got that wide breadth of clinics across the state of Oregon, and we really want to partner with them and help them be able to do much broader outreach and hit more of those people from diverse communities, especially those that are serving tribal populations. So we are seeing an expansion of our funds for that. Additionally, within OHA, within our program, we are trying to continue to maintain the integrity of the program. We've been doing a lot of work to continue to support data collection, maintenance. We want to get better. We've heard a lot of feedback from our evaluation report that things could be tighter. Things we want to learn more about and showcase more. And because of that, that's going to take a little bit of work on our staffing end and ORH's end to make sure that we can produce and capture that information. We want to continue to strengthen strategies into policies and procedures. We have a big, heavy rule revision that's coming up down the pipeline this fall. There's a lot of contracts and invoice that we have to manage and oversee and maintain, as well as grantee support, metrics, and of course, accountability to maintain the fidelity of all of these programs. I'll have to say I've been flying solo for a bit since we lost Kim, and we're lucky to have some additional staff to come in and help, because this is not a one person show. This requires a great team to be able to do all of this work and do it efficiently and effectively so that we can continue to do it. Equity and community engagement initiatives. Again, really wanting to enhance collaboration with our community partners to implement more equity-centered policy and programming. This fall, we're planning to reestablish our provider work group to kind of provide some external advice on how we can adjust and improve our programmatic processes. We've been working with an equity expert in consultation for this work as well. And then the biggest thing I think too is, which is really something that we're not quite over with yet. We have this biennial assessment and evaluation. So you guys are familiar, hopefully, with the healthcare workforce needs assessment. We had external evaluators assist with that process. And we're also going to include an external evaluator to assist with developing the evaluation report that we just had produced for you all this spring. So the evaluation of effectiveness of healthcare provider incentive programs in Oregon. It's time. We've received a lot of feedback from the Oregon Health Policy Board. So we really want to look to an external evaluator to kind of help us assess and process these legislatively mandated reports in 2027. Next slide, please. So with that justification, this is a bit of the breakdown that we have. So you'll see, again, this $4.34 million is not coming out of the $26 million that has been allocated to us from legislation. The Healthcare Provider Incentive Fund goes into an interest-bearing account, and we're using the interest earnings that are being to be allocated to the administrative costs this year. So some things of note: the staffing and salaries, we have seen a little bit of an increase. Part of the reason is adjusted cost of living adjustments, as well as step increases. We have to account for that within the Oregon Health Authority. And then you'll note it, you won't be able to see in the last biennium, but in the 23-25 biennium, we only had 1 year of that manager position. This biennium will have a full 2 years of the full biennium. So that has also been why there's been a bit of an increase that you'll notice from the 23-25 biennium. So really COLA, and then we're funding the full biennium for the manager position. You'll notice the biggest increase is probably with the contracts and agreements. Again, as I mentioned before, we had to factor in the cost of living adjustments and increase and added staff to support all the work that they're doing with the reintegration of the behavioral health workforce, the 40% increase, the data work that they're doing, the data restructuring that they're currently undergoing. And so that is an increase within their IGA, intergovernmental agreement. And then the other reason for the increase is the estimated increase for the external contractor for the biennial healthcare workforce needs assessment and for our first time provider incentives evaluation report. We have a slight increase in other expenses, including travel, because we do want to get out there more. We want to be able to showcase the incentives that we have. We want to be able to produce, wider documentation and have a much stronger marketing campaign to support and promote a lot of the incentives that we're doing. And some of that is going out and visiting the sites that we're receiving some of our incentives and seeing how they're doing and seeing what they need and experiencing what they're going through so that we can provide a little bit more information and report back on what's working well and where we need to kind of pivot and improve. So with that, we're on to the questions and comment section. I know Manu had Dr. Chaudhry had his hand raised, so we can go to the next slide and we can get into the questions and comments, I think, and then hopefully we can do a vote.
Okay. All right. Well, I see Megan, you've got your hand up.
I think Dr. Chaudhry had a question first.
You got a question?
Yeah, Megan. Well, Megan, you can. Oh, so sorry. Okay, we're being so formal with each other. This is great. So the question that I have is, I'm just trying to pull up my talking points right now. But the question that I have is it possible for us to add registered dental hygienists as a part of the dental providers or dental professionals, in addition to dental assistants and dental therapists, to be eligible to apply for the loan repayment program?
I think that's always an option. I think there's a lot we need to look into. We can't just snap our fingers and say, yeah, let's just throw them in, because that just increases the application pool, right? So just because we add new disciplines and we're increasing it, or hopefully we can propose to increase the amount of funding this year, we do have to consult with the Oregon Office of Rural Health to see what their capacity level is. So there's a lot of work that goes into that. And I would defer, I know John McElfresh isn't on the call today, but I think that's something that John was the one that kind of brought the proposal and compiled the data for expansion to dental assistants and dental therapists. So I think, working with him to kind of create a proposal that we can review to justify increasing that could be something that we would absolutely consider in this biennium. I'll also say that we do offer loan repayment to expanded practice dental hygienists as well. So there is that, but I don't think that covers what you're asking for. So happy to kind of defer you to John, and maybe you guys could work on a proposal together that we can review at a later date.
Great. I would greatly appreciate that. And just as a way of reference for everyone, we're all very familiar with healthcare workforce shortages that are occurring throughout the state. I believe that because of the aerosol generating particles from COVID, many of the hygienists had left the field altogether, and we experienced changes of 6 to 7%, since in losses in the number of hygiene workforce, and specifically as it's related to the registered dental hygienists, attracting them to serve the needs of our Medicaid population is very challenging. It's already very challenging with them being a limited workforce. And while we have more numbers of dentists and as a result, greater access to dental care or dentists for treatment, we don't have a hygienist for the preventive services.
Okay. Well, thank you for your question. I do need to let folks know, just to respect everybody's time, we do have a vote coming up and 5 minutes left in this meeting, I believe. So if folks can target their questions to the vote coming up and limit that as much as possible. Megan, I think you're next.
I had a question on slide 32 for the Show We Like programs that were listed. Are those the only eligible sites currently in the state? And if so, how were those specific schools prioritized for the funding?
Are you talking for the So we have a grant process. So this is a competitive application process that any educational institution can apply for. And this in the 23-25 biennium, everyone that applied was awarded. We didn't have to, we had enough funding to stretch for all of the applications. So you have to have a login through Oregon Buys. That's how Oregon Health Authority uses all of that. And I can explain more. I know we're kind of at a time crunch here, but happy to explain the process, either written in an email or message at some other point in time. But we don't choose them; they apply and we award.
Thank you. I appreciate it.
Yeah.
Okay, Kelly?
Hi, this is directly related to the budget. On slide 32, you have MACBO and QMHA2s. There is no such thing as a QMHA2 in statute. And I don't know if we're going to have to vote on this budget as a whole or if it can be amended, but only COA agencies can bill QMHA services, and COA agencies can also credential their own QMHAs. So I personally don't see, and I'm the CEO of a counseling agency, a need to support QMHA2s with MACBO. And then the other thing, I'm just doing the math, and on your administrative support, you have 5 FTE at $1.74 million, and that averages out to $174,000 per FTE over 2 years. And I realize that's not all salary because there's benefits and so on. That seems really high. And the administrative rate increase, it's up to 14% of the budget, and the previous year it was 11.7% of the budget. So you did a great job of explaining the differences, and given the great need out in the community for our direct service providers, just want to put a pin in that.
I can address quickly the MACBO concern. So we're not voting. This is the MACBO funding has already been allocated for the 23-25 biennium. But that's just an example of what the retention incentives could look like. I'll go back, and this was based on data reporting that we received from MACBO, and I'm not a behavioral health person, so I can go back and check those numbers again and get a little bit more information from our contact there. But you're not necessarily approving the MACBO award fund right now. That's just an example of the retention incentives in the 23-25 biennium that wasn't included in the evaluation report because we launched into the executed contract after the evaluation was completed.
Thank you, Jill.
Yeah.
Thank you. Jason, last question.
Just to follow up on the last comments about the administrative costs. So I also think, looking at the administrative costs there for the staffing and salaries, those figures do seem high, even building in the budgeting. And maybe that's just my lack of understanding around the salaries for those positions, but the optics of it at least are high. Second thing, the contracts and agreement line there, where we're really increasing significant percentage. I wanted to clarify, is the contracts and agreement costs, are contracts an internal group, or is this all for external consultants?
So the vast majority of the contracts and agreement is for the Intergovernmental Agreement budget with Oregon Office of Rural Health. And then we don't have an external evaluator. So this is all budgeted. Like this is all like type of, we have a pretty strong estimate on what we want to use. So we've allocated a budgeted amount for an external evaluator. We may not use, we're trying to, I think what I would like to say is we would rather ask for a little bit more. And if it doesn't take that much money to do, that's fine. We could roll things over into the next biennium. But I think our approach for the administrative costs, especially with not having that secured external evaluators, we just don't know what the cost is going to be. It could be $500,000. It could be $300,000. So we wanted to give ourselves a little bit of a buffer so that we don't have to come back and ask again for an additional amount of money for an external evaluator for that. So I hope that answers your question. Those are the two main contracts. Yeah.
It does to a degree. So I think, anytime the public sees things that are viewed as consultants or external evaluators, which are also viewed as consultants in the public eye, where we're having a $2 million requested budget, but for full-time staff, we actually have we have more full-time staff and fewer consultants, but the consultants, I'm going to put air quotes around the word consultants there, their expense exceeds the staff. I think that the optics of that aren't strong. It looks like we're suggesting paying a small number of consultants $2 million and paying $1.7 million for full-time staff. I just don't think that plays well in the public. I'm not doing a great job of explaining that, but maybe somebody else can kind of follow up and make sense of that for me.
Jason, if I can just add on a little bit to what Jill said, and I recognize that, the administrative costs are going up pretty significantly from last biennium. We did add during the last half of the 2021-23 biennium a manager position, given that this is a complex program that requires coordination with our other incentives and grants, the oral health workforce grant program, the primary care office. So we did add that manager position for 1 year, and we saw a lot of value from that, and also to communicate externally and across the agency, because workforce also resides in multiple state agencies as well. So that was part of the reasoning for adding that person. And then, we heard pretty strongly from the Oregon Health Policy Board that there was a desire to strengthen the evaluation. And so we're hoping that it's a one-time cost, that we could get someone to help us establish the framework for a more robust evaluation process, because we're limited within our team of what we can accomplish. And so that's part of the reason too for investing more in the ORH contract to improve that program integrity.
And I get that. I think in the political world we're living in right now and the budget crunch that, federal governments or state governments are facing, layoffs happening across the state, I would feel more comfortable if some of these figures were maybe broken down a little bit more, as far as like, what are the salaries of these positions? What are the breakdowns of the external evaluator cost? What is just breaking it down a little bit more so that I would have greater confidence in understanding that, yes, these figures make sense. Right now, just looking at what's presented, I don't have, and I'm sure the numbers are there, but just with what's been presented, the figures seem high to me. And that may be my lack of knowledge. I totally acknowledge that.
Yeah, and then also I just wanted to add too that our state positions come with salaries and benefits, and so that is part of the expense.
Yep.
Yeah. And I can appreciate what you said.
Okay. I know we're in a place where we may not have all the information that we want. I also would like to respect everybody's space and at least call a vote and see where we're at. Okay. Please remember, if you have questions in between meetings, you can always reach out to OHA staff to get more information. That is an option. They've been great at responding to questions and whatnot. So, Jill, I hope I'm not speaking for you, but I sort of am. There is an availability there. So I'm going to ask, do we have a motion to vote on this issue? Motion to approve.
Sure, this is Gretchen Horton Dunbar. I'll motion that we call a vote.
And this is Levi. I can second.
Okay, we have a second. I'll go through the roster, and if folks would let us know, yay, nay, or abstain. Aaron Hines. Elena Shablowski.
And I just wanted to note for the record that Aaron left the committee. He resigned. So
Got it. Thank you.
Sure.
Stop calling out his name. Okay. Elena Shablowski.
I'll abstain.
Okay. Alicia Jackson. Koi Vu. Eric Weiser.
Since AHEC's in the budget, I have to abstain due to conflict of interest.
Thank you. Gabriela Carrillo. Gretchen Horton Dunbar.
Yay.
I'm on the list next, so then I would be yay. Jason Johnson.
Nay at this time.
Okay. Judy Geiger.
Yay.
Kelly McKnight.
Nay.
Larissa Mejia Medina. Levi Anderson.
I also need to abstain for conflict of interest.
Okay. Manu Chaudhry. Megan Holland.
Yay.
Molly Reynolds.
Yay.
Rob Ross.
Yay.
Bob Lieberman.
Abstain.
Dr. Hemmings is not here today. Stephanie Grayson.
Yay.
Surya Karlapati.
I would vote yay, but I want to make a friendly suggestion. I'm sure this is being considered. I understand the reliance on consultants, but maybe we should also have a plan to take all the information or all the work capabilities of these consultants and at some point turn these consultants into a full-time employee and add to our workforce. That's my only suggestion, but I support yay.
And Tessa Christensen.
Can I abstain right now just because I'd like to see more clarification in the budget?
Certainly.
Okay.
Okay. I believe. Let me see. Elena, did we get your vote on this one?
I abstained, yeah.
Oh, okay. Got it. Great. Okay. DP Neelam, did you get what you need?
I could not hear Megan's vote. Was she a yay or a nay?
Yay. Yes.
Okay, great. Thank you.
So approved, I believe. Is that correct?
Ian, what we could do, given that, there were some nays, we could come back at the November meeting or at the September meeting, and, address some of the concerns. And I hope we could still go forward with the OHPB meeting so that we could, get their approval and proceed with spending?
So we're looking at more information for this committee at the September meeting, but moving ahead with the request for the September Oregon Health Policy Board. Is that correct? I'm just making sure I understand.
Yeah, no, I'm wondering whether or not this, because I recognize that, you know, we did have some nays and concerns, whether or not we can proceed, if the committee is comfortable with us proceeding to present at the OHPB September meeting for approval. OHPB has a retreat in October. So if we were to delay, then we wouldn't be able to go in front of OHPB until November. And we would be happy to come back with additional information at the September Healthcare Workforce Committee meeting. Or we could also hold another special meeting as well. But I recognize that, you know, everyone's time is precious.
Yeah. Judy, I see your hand up.
Yeah, can I just ask a point of clarification? So to approve this, do we just need a simple majority of the people who are here, since we had a majority of our committee? Is that the rule on it? Because it looks like that's potentially what we have. And then some of the abstains were not because they had concerns, but because they had a conflict of interest.
How about
And I just wanted to, can I address the conflict of interest? So the funding, like for Dr. Weiser, you know, with AHEC, that was approved in 23-25. We don't have any awards going through because we haven't received approval for funding. So we haven't expended any 25-27 biennium funding. So I don't know if that makes a difference. What we were presenting was the scholarship information because it wasn't included in the evaluation report that was presented, because the awards were made in between the end of the evaluation period and the end of the biennium. So that was just kind of an informational piece of information for you guys to see what we're spending the money, what we're proceeding to spend the money on for the scholarship awards that were already awarded in 23-25. So I don't know if that helps with with the abstentions, but you know, it's up to you. I just wanted to clarify that no funding has been awarded. No organizations are being taken into consideration at this point because we haven't been able to spend any of our 25-27 biennium funding yet.
Okay. Bob?
Yeah, how about we bring this to OHPB and let them know that it did pass this committee, but that there were some concerns, and it's almost like a minority report. Let them know what the concerns are so they can hear those concerns and decide what they want to do, because we're not the final decision maker here anyway, if I understand it correctly.
That's correct, Bob. Okay. I'll tell you, I like the idea of making sure that as a committee we understand the program because we have responsibilities around the program. As Judy mentioned, this is, I believe, a majority vote scenario. So I believe we can support this as having been gone through the committee, but I like the sort of minority report concept. Of passed with some concern from certain members of the committee, and just say it there. Dr. Weiser?
I was just going to comment, like, recusing due to conflict of interest about being part of the budget of this is a good thing. It means you probably have the right members on this committee. um, who are both vested and knowledgeable about the healthcare workforce in Oregon. So I don't see necessarily recusal as a problem as a necessarily just as a state of who you have on the committee, which is a good thing. And then the comment about like I think we have to just be mindful about the details of personnel budgets. It's a small number of people. We don't really want to get into the business of knowing exactly what they make. And so while I do agree we can do a little bit more transparency on some of the workforce or the specific staff member administrative fees, we don't want to get so granular that we know who they are, we know who their dependents are, we know their salary, because that is that we should really be protective of employees across the board.
Chris, thank you.
Yeah. Hi, everyone. Chris DeMar, she, her pronouns. I'm with OHA. I'm the Director of Delivery System Innovation, and Neelam's team sits within that. And I'm also kind of help staff the Oregon Health Policy Board. So I have a broad perspective on this. And I will just say, I think it would be much better to go to the Oregon Health Policy Board without saying that there are concerns with the committee. Like, let me say it a different way, with addressing the concerns before they go to the health policy board. Because what I'm concerned about is the health policy board would just send it back to this committee, and that would take more time. And so my suggestion, I know it's not ideal. I know you're all very busy people, but to try to plan a separate meeting before it would go to the health policy board in September. Or we can try this approach, but I would be surprised if they were comfortable voting yes, without knowing that the committee had already approved. Well, voting yes, given that there were concerns. I guess I should say that. I understand that it is a majority decision here, but it just feels more procedurally streamlined to me to ensure that the committee members that have concerns have been addressed before going to the policy board. Now, just thinking out loud here, I'm feeling like pressured for time, and I know you're all staying longer than you need to. Perhaps we could have individual conversations with the two people that voted no or something like that, and then we could comfortably go to health policy board. I mean, saying that there were people that voted no, but we talked to them afterward and addressed concerns. I'm not sure, Neelam.
Yeah, that's what I was
welcome you to
thinking
chime
too.
in.
Perhaps, meeting with, because I counted two nays. And so I think meeting with them to make sure that they feel comfortable and confident. And then we could convene a quick meeting and hopefully get to all yays for people who feel they can vote.
And it does have to be a verbal vote. Is that correct? It couldn't be online. Okay.
To change the public meeting laws.
Yeah. Okay.
823,
Okay.
we do have to either meet virtually or in person and have a verbal vote.
Okay. All right. So since it's about 20 minutes after the end of our scheduled meeting,
Can I interject briefly?
Sure.
I don't mind changing my vote to yes, as long as we have more clarity around. I mean, I think, what was his name, Jason? I think he brought up a good point of just having some clarity on, what's included in the administrative costs without getting too deep into anybody's personal business. Although it should be all public information anyway, is just, I mean, that's my perception. But I can change it to yes. I'm interested in hearing more about it, I guess.
Okay.
I think we need to work with our budget team to get that level of information to provide. So that's why I think we would, unfortunately, with the questions, you know, again, we'd be happy to get that information, meet with the folks who had concerns, also share it with the the rest of the committee, and then we would need to have a special meeting.
Yeah.
I guess, do we really have to have everybody have agreement? I mean, it's why it's a committee and why we all have different opinions. If you have a majority and that's the point of this, I mean, do we really have to have another vote to see if we've swayed the people who really had some strong disagreements with it? And I mean, I think they had fair points, but I don't know that, do we really have to go back and do this again?
I have another comment there. I hear you, Judy, and that makes a lot of sense. And just to give you perspective, historically, there have been questions at the policy board about the administrative costs. And so I feel like that could be an issue, but we could see how it plays out. And is Jason still on?
No, Jason had to leave.
Yeah, okay.
Yeah. I mean, I'm not even sure we have quorum any longer.
Yeah, people might have dropped off.
Yeah.
Yeah.
Okay.
I mean, my thought is if we can get the information that was requested and get it to folks, we already have a yes vote. But I think that respecting the information and the choices of the staff who had no votes, if we can get that information and send it out to the, speak to those two committee members, but send that information out to the whole committee, that we can then go to the Oregon Health Policy Board and support this moving forward without having to try and get trying to herd cats and get this whole group together again. Chris?
Yeah, so that's fine. So are the remaining committee members comfortable with going to the Health Policy Board and saying, it got out of committee, it was a majority vote. There were a few people with concerns or questions about the administrative costs. We provided more detail, and then we will also provide that detail to the Oregon Health Policy Board kind of proactively to, so they will have all that information. That feels a lot better to me than just saying there were some members that had concerns. I think that's what I wanted to make sure that it's like kind of that full circle addressing the concerns is communicated too, but I want to make sure that you're all comfortable with that being the message. Assuming that is what is resulted out of those two conversations, because I can't, presume knowing what will come out of that, but hopefully we will have addressed the concerns.
Okay. Now, I don't think we have enough folks for a vote right now.
Yeah.
But can we do a straw poll and just see, is there anybody who can't live with us moving forward as proposed? So try and get more information, get it to the have a conversation with the folks who had issues with it, get that information to this group, and then have that information available to the Oregon Health Policy Board. Anybody who raise your hand if you're a no vote on that. Okay. I really want to appreciate everybody hanging in on the call and taking the time to work this out. So Neelam will put the to-do list into your hands, is that, or Chris?
Yeah, Neelam and I will work together, yeah.
Great.
With
great.
DP. Mm-hmm.
Okay. Thanks, everyone.
Thank you.
Okay. Neelam, do you need anything else from me?
Thanks. And Annette, can you stop the recording? Thank you. Thanks, Ian, for all your support.
I didn't know where to go with it. To be perfectly honest, it was kind of like, huh.
Sure. Yeah. Well, we're all trying to navigate this together. So thanks for your.
No, like I've said this before, I think that the healthcare provider incentive program is one of the best things we're doing.
Thank
And
you.
I really do want to support that work.
Yeah.
All right.
Thank you. All right.
Thanks, all.
Yeah. Bye.
Have a great day.